1 year on, and after doing spectacularly well and handling the first wave, it seems Germany is struggling to contain this third wave of the virus.
Yeah, that's right. And I think there are a couple of reasons. One of them is just it's a federation here. Decisions are taken between the German Chancellor, Angela Merkel, and the 16 regions who may or may not apply the measures she thinks are needed, and she's a scientist and is very concerned about the coronavirus, as much as well as thoroughly as she would like. The latest we have here in Berlin is what we just heard from the health minister, Jens Spahn, saying, look, there might be another lockdown. And he pointed to one of the other reasons why this third wave has been in the making. It's because of the slow rollout of vaccines in Germany. We're far behind the United Kingdom, the United States, as is the European Union as a whole. And he said, even though there's been some hue and cry at the European Commission and they've tried to get more vaccines in, it's not enough to stop the third wave. And the head of the Independent Infectious Disease Society, the highly respected Robert Koch Institute, said that we went from 90 cases on Wednesday to 95.6 on Thursday, and that the increase was exponential. Once you blow through the 100 point of cases per 100,000 population, then it's a hard lockdown. And they're actually talking about that today when Angela Merkel and the regional premiers meet to decide on the way forward.
Now, Angela Merkel's party did not do well in regional elections, with many blaming public anger towards the government over its handling of the vaccine rollout.
That's absolutely right, Annette. That was people are sick and tired of Germany having actually had the scientists who discovered the first vaccine, the Pfizer-BioNTech vaccine, and then people not getting it, and then a kerfuffle over whether the AstraZeneca vaccine was safe to use. And now we know that the EMA, the European Medical Agency, has said it is okay, so it will be used. And there are reports that some vaccines are literally sitting on the shelf, and at the end of the day in the vaccine centers, the doctors are saying, is there anybody who wants a shot regardless of your age? So all that really doesn't look very good. What they're talking about in this meeting I referred to earlier is whether or not GPs should be involved in giving the vaccination. And I think, that is going to be in the offing. But just to return to the politics of it all, the health minister was very popular at the beginning of the pandemic when numbers looked good. Now he's not very popular. Angela Merkel remains popular because she's been in power for 15 years and has seemed to have governed very well. But her party is hard hit and has been hard hit. Two of its members actually have been accused of profiteering from the pandemic, gaining commissions on the sale of masks that we all have to wear. So that certainly isn't going to help them, hasn't helped them recently, and may be quite damaging in the upcoming September elections.
Nick Spicer reporting there from Berlin. Thank you.